Welcome back. The Ebola outbreak in eastern Congo is becoming more difficult to manage after an attack on another hospital yesterday, the third in the last week. A group reportedly stormed the facility, demanding that the bodies of two deceased relatives be handed over, while medical staff were forced to evacuate amid gunfire. Congolese authorities have tried to limit access to the bodies of Ebola patients, which can remain highly contagious even during funeral preparations. The government there suspects more than 900 people are infected with the virus and attribute at least 119 deaths to the outbreak. But those numbers are believed to actually be much higher, as the virus likely spread for weeks before health authorities even became aware it was happening. Joining us now, physician and senior public health contributor for Forbes, Dr. Omer Awan. Doctor, thank you so much for joining us this morning. This is obviously a terrifying disease, highly lethal. Let me ask you now what I just did off air. First, let's just talk with Americans, with those who are watching here at home. How worried should they be?
Not very worried, John. I mean, the risk to the general public is going to be very low. Not zero, but it's going to be low. Those that are most at risk are obviously those that live in Central Africa, places like the Democratic Republic of Congo, Uganda, where it's spreading currently, and also healthcare workers, those that are actually treating sick patients, and caregivers at houses that are treating other people as well. So, this is a disease that spreads through direct contact with infected bodily fluids. It's not an airborne disease. So things like saliva, sweat, blood, vomit, those are the people who are directly interacting with those patients that are going to be at most risk.
And I think that these headlines of these medical centers being stormed by, in some cases, grieving loved ones who want to reclaim the bodies for religious funeral purposes and the like. But this is highlighting the risk that the healthcare workers are undergoing, but also a real mistrust in the system.
Absolutely. A lot of mistrust, just like we have here in America, where we have a lot of mistrust for federal authorities with respect to health. Remember, one of the ways that you can get Ebola is by, cleaning bodies at a funeral. There can be transmission from, washing a body. And for many people that live in the Congo, this is deeply personal. Being able to wash a body, this is a rite of religious passage. And to be told that you're not able to do that by federal authorities, that can lead to a lot of mistrust, particularly in an area where there's a lot of political turmoil, a lot of military action. That can be very difficult and very challenging for people.
And what would you say is the impact of the cutbacks by the Trump administration to medical research, yes, but also to U.S. aid abroad? Or something like this, an outbreak like this could worsen because the U.S. simply isn't able to help like we normally would?
I would agree with that. I think what we've done is we've dismantled our infrastructure and our ability to contain this virus by these deep cuts. We're talking about hundreds of millions of dollars that we invested. This was done to increase our surveillance systems, to provide diagnostic tests to detect the disease. And what people often forget is to train epidemiologists to go there and to contain the outbreak. That's not there anymore. So it should be of no surprise to people that we haven't been able to detect this disease, and a lot of cases went undetected for weeks, if not months.
Yeah, same concerns over the hantavirus, of course, that outbreak on that cruise ship. Thankfully, it just seems to have been relatively contained, at least so far. Doctor, while we have you, turn to some other topics here. You wrote a piece for Forbes recently about screen time and the Surgeon General advisory on the use of screens, particularly for children and teenagers. Talk to us what you found.
Well, I think now that the science is a lot more nuanced than just harms or benefits. Really the effect and the health outcomes from screens and social media is going to be a result of a kid's age, for example, what they're watching, and whether or not some of these activities are going to displace other activities like social interactions and learning. Being a kid watching Miss Rachel, for example, and learning is a lot different than a teenager scrolling nonstop on Instagram. So yes, there are absolutely harms with social media. A lot of studies have shown that the more you are on social media, the higher the rates of stress, anxiety, depression. But there are benefits as well. People learn on social media. People are able to interact and express themselves on social media. So I think the challenge now is going to be, how do we optimize the benefits of learning while mitigating the risks of overuse and mental health?
So we've been talking a lot this morning about AI, artificial intelligence, and the Pope even put out some writings on it this morning. And there's a lot of polling shows Americans are deeply mistrustful of AI in terms of the economic consequences, the costs of data centers, but also, of course, the idea that it might take jobs. But there are some benefits, too, even as we focus on the negatives, you argue anyway. In terms of medicine, that AI can really be helpful there. Talk to us about what you mean.
Well, it's transforming medicine in a really profound way. I mean, it's making us more efficient. It's allowing us to decrease our bureaucratic tasks, paperwork, et cetera. And it's now a partnership. It's not a threat. If you had asked me this question 5 or 10 years ago, we would have been like, oh, maybe this is a threat. We're going to lose jobs. But really, this has become a partnership to allow us to do our job more effectively. Now, it's not perfect, right? It makes mistakes. And that's why physicians are critical to make sure it's not harming people in maybe the mistakes that it makes. Also, there's bias, right? Like AI is trained on data sets, and data sets are inherently biased. And some of the results may not be generalizable to certain patient populations. And that's where physicians come in to ensure that it's not harming people. I think the bottom line here, John, is that, people want to be heard when they come to a doctor, right? People want empathy, compassion. That's something that a computer or a chatbot is never going to give a patient. And that's why AI is never going to replace physicians, but certainly it'll be working hand in hand to allow us to treat patients more effectively.
So that's a pretty positive view on, AI being a tool for physicians. Now, what would you say about, we frankly see more and more about folks at home, regular folks, not doctors, but turning to an AI chat or something or an app on their phone and using that as medical counsel? Is that a wise choice?
Well, it's being done. Whether or not it's wise or not, people are doing that all the time, and people are increasingly turning to, ChatGPT, for example, to answer questions. I think overall it's a good thing. It's a positive thing that people are learning, taking ownership of their healthcare and trying to learn different diagnoses, trying to understand things in a way that resonates with them. But with that said, it can make mistakes. So I think it's important for patients to come and talk to their physicians, ask them questions, especially if they don't understand a certain topic about their diagnosis, their disease, their treatment. Really important to ask all those questions to a doctor, because ultimately it's a doctor that's the expert, not an AI tool.
All right, physician and senior public health contributor for Forbes, Dr. Omer Awan, thank you so much for joining us. You can read his latest writing at Forbes right now.